Good morning, everyone. Welcome to Hatherleigh Behavioral Health's Coffee and Chat. I'm Kortney Asanka. I'm a licensed clinical mental health counselor, a life coach for student athletes, an author, and a continuing education course content creator for Hatherleigh. Today, we have a very expert guest, Dr. Kay Towns. She'll be talking about grieving and her book, Grace, and a model for grieving, which I think is going to be very helpful to all of us. Just a few housekeeping items before we get started. We ask you to mute yourselves. There'll be time for questions and discussions at the end, so you can unmute and talk to all of us. We'd like everyone to be engaged, so if you feel comfortable, feel free to turn on your cameras. We ask everybody to just use respectful language, especially when we're talking about, grief and grieving. And if anybody is experiencing technical difficulties, try to sign on, sign back off, sign back in. We'll let you in. And hopefully everybody has a great conversation today and connection and learns something about the grieving process. So I'll throw it over to Andrew to discuss a little bit more about Hatherleigh Behavioral Health.
Oh, thank you so much, Kortney. Good morning to you, and good morning and welcome, Dr. Kay Towns, and good morning, Stacy. Yeah, just super quick. I wanted to, number one, let everyone know on the call today that we had a few requests for continuing education credit for participating. This call itself is not a CE. However, we do have available through the kindness of Dr. Towns a free 1-hour course on the Hatherleigh.com website, which you can enroll in, and it will sort of essentially review some of the material from today and provide you with the CE certificate at the end. So I'm going to hopefully share my screen. Maybe that will work or not. So stand by. And I see where that is. Hold on. Great. Yeah. Okay, so here, do you all see that?
Yes.
Okay, great. So this is the course, and you see, enroll now, it's free and is 1 CE credit. So definitely I recommend everyone on the call to go to Hatherleigh.com after the call, register for this course, complete the CEUs, and earn your certificate. Another thing I want to point out, and we'll probably talk about this more moving forward, if you go to your dashboard now, you may notice, and I'm going to go to my dashboard, you may notice a new feature down here, and it is a community. So this area on your dashboard will open a window to the new Hatherleigh Behavioral Health Professional Community. And this community is designed just for you. It's interdisciplinary, so we invite all behavioral health professionals to participate. And it's a way for you to connect, collaborate, and discover. So what does that mean? It means that you can pose challenging cases, perhaps, that you need some feedback on, share tips and ideas on your work. You can share upcoming events that are relevant to your community. You can also find out more about things happening with Hatherleigh, other Zoom calls, other web events, and so on and so forth. So it's really designed for you. And we welcome you to, explore and start, go on, introduce yourself. And the more who participate, the better the experience will be. So with that, I'll turn it back to Kortney, and thank you all. Good to see you here on today's call.
Thank you, Andrew. One thing I forgot to mention, if you have any questions or if you want to introduce yourself in the chat, feel free. Tell us your profession, where you're from, just a better way for all of us to feel connected. So today, like I said, we are diving into Grace, a model for grieving. And Dr. Towns, thank you so much for being here. I think it's a very relevant topic. Everybody is going to experience grief at some point in their life personally or with their clients. And I was telling Dr. Towns before, I think she is the perfect person with her professional background to give a better understanding on this topic. She is a licensed professional counselor and an ordained Methodist minister. So welcome, Dr. Towns.
Thank you so much, Kortney. I'm really glad to be here.
So we're going to go right into it. If you want to tell us a little bit more about your background and how you decided to create this book and why you think it's so beneficial and needed for the behavioral health community.
I appreciate that. Well, the truth of it is I never set out to write a book, much less to create a new grief model. It happened out of a place of need. So as you mentioned, I'm a licensed professional counselor, and I'm also an ordained United Methodist minister in what's called the Order of Deacon. So my work has often centered on supporting those who are struggling with losses, losses big, losses small. So during my training at the Menninger Clinic in Houston, I created and led an inpatient grief group. And at that time, I was also helping patients and clients in individual settings, in community settings, church settings, and in private practice. I routinely kind of ran up into this roadblock, which is I became frustrated because the current grief models that I was using at the time were lacking what my clients needed. And so it was out of that need that I began to create what would eventually become the Grace Grief Model and these two books. So the concept, conceptually, this model originated during that time in Menninger. And then I expanded on it during my research and foundation and formulated the major precepts kind of during my college doctoral work. And then later kind of finalized the creation of it all during my work in professional counseling. And the model is, I offer this as an alternative grief treatment aimed at facilitating the grieving process and just offering another way that is adaptive, that is healthy for those of us that are out there trying to treat those struggling with losses of all types.
And I think it's a great model. As I was reading through the book, I think it's great for clinicians. And then the workbook, I think, is great for clients because a lot of times in normal day life, and even when we are grieving, we want to feel that sense of control. And I think that there's very tangible, objective goals that they can, set for themselves and the activities they can do in the workbook to feel, a little bit more in control and better about this process. So I think it's a great model. So could you tell us a little bit about, a basic overview of grief and how this model differs from the stages of grief that we might be more familiar with?
Yeah, okay, so first, this model kind of tackles this idea of what is grief. It really takes a different approach at looking at defining grief and really redefining grief. So I'm going to back up and talk just a minute about kind of what's the big deal about grief. And it kind of stems from what you mentioned, and that is that every person that we meet with is going to be experiencing loss at some level at some point. And so grief really is this kind of universal conversation that is going on, whether we're talking about it or not. And it's in every setting, in every counseling setting, in every doctor's office. Grief is often that kind of underlying issue that goes unaddressed. So we have this profound need to talk about grief. Grief, by and large, is kind of handled in the sense that people will have what's called normal grief, right? Which means it'll progress and they will go through it into a place of kind of healing, and they will move through it in a normal fashion, not a normal pace. That's individual, but a normal and healthy fashion for them. One of the reasons we need to pay attention to grief in our profession is because, as we know, grief also now has a diagnosis component to it, and that is this diagnosis of prolonged grief. So prolonged grief is that grief which used to be also referred to as complicated grief. This is grief which is extreme, grief which goes on for prolonged periods. These have this level of grief, this type of grief, I should say, has adverse effects mentally and physically, and causes significant impairment in functioning, and now is a diagnosed mental health condition. So it's something we need to pay attention to. The prolonged grief piece, I would say, happens in about 10% of the bereaved populations, is what research tells us. But in certain subsets of that, including those that, for example, the loss involves some kind of an unnatural or violent death, that jumps to over 35%. So one of the reasons we need to pay attention to grief is not just because it's kind of ubiquitous and everywhere, but also because we have this new diagnosis feature of prolonged grief that we really need to pay attention to in our profession. So, Kortney, I think I've totally gone off track, and you were asking me about the model, about
I
asking.
know, I think it's fine. Any way you want to do it. We're learning a lot.
Me again. I told you I'm a little passionate about grief, and you'll have to redirect me if I go off on a tangent here. So
That's all right. But we can come back to the model, but there is a question, because it did say in your book that women are at a higher risk for grief complications, and you're talking kind of the subsets. And I think I found that kind of interesting, because I think it also said that women sometimes seek out more help or are more expressive or communicate more. And I would think that would make it easier for them to go through the grieving process. But apparently not.
You know, some of the research around women is just kind of interesting altogether. You know, the research also tells us that women are at higher risk of severe mental health disorders, which I was having this conversation with someone yesterday. I said, you know, I'm not sure I'm 100% on board with that for certain reasons, but some of the justification as far as why women are at higher risk seems to be debated. For example, prolonged grief, which is what we were just talking about, that kind of extreme grief where it goes from acute and just kind of moves into this this complex, complicated grief. Prolonged grief, older women especially are at much higher risk for prolonged grief, and that's a population subset that we have to keep an eye on. Is our senior women who have gone through major losses. They're at significantly higher risk for prolonged grief, and the physiological and psychological impacts of that, which are pronounced. So as far as why, I couldn't really, that's not in my wheelhouse. I could say that anecdotally, I can tell you that number one, I think more women are coming in. And secondly, when you get into the senior population in some subsets of cultures, I think women tend to outlive men. And so they are faced with losing that spouse. And so statistically, I think that's maybe why women have that increase in number as far as why women are struggling from prolonged grief. But women, as you pointed out, we just think about our practices, in mental health care. Who is it that typically comes in? Anecdotally, I can tell you it's in large part women. So, right. And that goes to, maybe a conversation about stigma, but so did I answer the question for you?
Yes, thank you. Okay, so before we do talk about the model, can you go through briefly the different types of grief? Because we know everybody grieves differently, but I think it would be important to notice. So as clinicians, we can tell, where they are in the grieving process and what we can do to best kind of help them at the point that they're at.
So there's all different types of grief. And so when we're talking about different types of grief, some of the ones that we're most familiar talking with, of course, is what I just mentioned, which is normal grief. So normal grief is going to be, this is a healthy, grieving is healthy and normal. We're supposed to grieve. Our human condition is hardwired for grief. This is a good thing. And grief is supposed to go from kind of in this kind of normal rhythm into something that goes from moving through an acute stage, right? So this is kind of normal grief. Prolonged grief, which is what we were also just talking about, is when that normal natural flow of grief is disrupted. And so what happens is that interference of the grieving process could kind of herald the onset of prolonged grief, which if it's prolonged grief, that does require medical intervention, support, and a diagnosis. Mm-hmm. The other types of grief are disenfranchised grief. Or another type of grief. Disenfranchised grief is when we cannot grieve openly or publicly. In other words, it's not socially supported. It's often where we can't publicly mourn. These are things like in the ministry setting, what we would see is these were referred to as the non-casserole events, where someone who had cancer, for example, the casseroles showed up, the calls showed up, the emails, the texts, the cards, they were there. But when someone was diagnosed with a significant mental health illness, or a disease that was seen as controversial for that time period. I grew up in the 80s, for example, when I saw this firsthand with the AIDS epidemic. Then what happens is what's called the non-casserole event. These are disenfranchised griefs. These are people struggling with LGBTQ plus issues. These are people struggling even with things like pregnancy losses, disabilities, any kind of maybe affairs or estrangements, pet losses even can be called disenfranchised grief. Another type of grief is ambiguous grief. Ambiguous grief, these are the ones that have no closure. So these are situations where the loss is kind of unclear or unverified, such as if you have someone like missing persons, kidnappings, estranged family members. That's also a type of ambiguous loss. Ambiguous losses are kind of interesting in that there's a physical aspect where there's the loss is physical, like a missing person, or it's psychological, where the loss can be the presence of like a dementia or a severe mental illness. And so these are examples of ambiguous loss. There's many other types of losses. Abstract loss is another type of loss, like something abstract, like the loss of hope, the loss of love, those types of losses. So those are just some of the losses that are pretty common that we see and treat in our offices every day.
A quick question, Kay, from our community. Would suicide be considered a disenfranchised loss?
Well, I think suicide can be considered a disenfranchised loss, right? Because this is a loss that too often is associated with a lot of stigma. And because of the stigma in certain populations, it definitely can frequently be something that is not publicly acknowledged, not socially supported, and not publicly mourned. Absolutely. I can tell you this from my pastoral background, that it's becoming less common now, but I'm saddened, heartbroken really, to share how many times a family would come in and the death was caused by suicide, and they would change that, and they would ask us not to reveal anything. And so it was, yes, it absolutely can be disenfranchised.
So Dr. Towns, would this be a good time to discuss your worldview and loss view and how those align in the grieving process?
So in the Grace Grief model, I created what I call a grief map. And the grief map, I'm going to talk with my hands here for a second because it's kind of hard to, I'm wondering if I could kind of pull it up and show, I will hold it up as I'm talking so that maybe someone can see it. But let me kind of do this. So the Grace Grief map kind of helps us orient ourselves as far as where we are in the grieving process, right? This is kind of a navigational opportunity here. So it's in my book and in my workbook. And this is a little awkward, but I just want to visually kind of show you an overview of what this kind of looks like. And where it starts is we have what's called a worldview. Our worldview is how we make sense of our world and our place in it, right? These are our beliefs, our values, our ethics, all of that. Those things that inform us and how we view our world. That's our worldview. And then we have a loss view. The loss view is the story we tell about our loss, that narrative, the story that we believe and buy into about whatever that loss event is. Most of the time, what happens is the worldview, which is the bigger, so the worldview, this is our worldview, this is our loss view. When the worldview and the loss view align, when they come together, then you have what's called alignment. And usually what happens at that point, then the grieving process moves forward. But what happens when the worldview, how we understand the world, doesn't align with our loss view? And then you have this misalignment. And that's usually where people get stuck in the grieving process. An example of that would be, I worked with a woman whose daughter had died, and it was a drunk driver situation. It was quite tragic, and the daughter was young, and the mother was a very strong in her faith, devout Catholic who really believed that bad things were not supposed to happen to those who did good things. And if I just had enough faith and belief, then bad things weren't going to happen. Well, you can imagine where her worldview and her understanding of how things were supposed to happen did not align with her lost view. Her precious daughter, who was quite young, was taken tragically, and it didn't align with her understanding, not just of other people, but also of herself and of her. In this case, it also affected her spirituality, in the sense that now, where was God in this? So for her, from someone of faith, where was God? Where was the God that was supposed to protect my daughter? Where was the God that was supposed to bring justice for this situation? And so how we helped this woman was, I helped her work with our priest. And long story short, she was able, over a period of time, to expand her lost view in a way that was healing. In a way, for her, that meant she was able to realize, God was with me all the time. God was with my daughter all the time, right? And so for her, that's an example of how the lost view and the worldview in alignment or misalignment really impacts the grieving process.
Thank you. For counselors or anybody working with clients,
Mm-hmm.
how do you feel like the counselor's view of grief and even death impacts the clients? And if yours doesn't align with your clients, how can you best help them through the grieving process?
That is an excellent question. And that was one I wrestled with 10, 20 years ago, which is why I'm here today. I think one of the things as counselors, we have to, number one, acknowledge and work through our own grief, right? Do our own due diligence, do work on our self-care before we come into that counseling setting. So we have to be healthy before we enter that counseling setting, and at least working on our stuff. I think one of the biggest things that informed me in a way that I could have a healthier relationship with my own grief and in sitting in the counseling settings is the grief model that I operated from. So there's all different grief models that we're taught in school, right? But you can do stage theories like Kubler-Ross, which this model is not a stage theory. It has steps to it, but that's different than stages, right? And so you can do Kubler-Ross, you can do William Worden, you can do the dual process, you can do attachment, you can do meaning making from Niemeyer. There's all different ones that we learn. You find one that actually aligns with not just your beliefs, but meets your client's goals, meets your client's needs. And that's where I struggled. I couldn't find one that that holistically kind of, and I couldn't also I kept combining them until finally it was like I realized, oh my gosh, I'm going to have to create something. So my advice to counselors would be, first and foremost, work on your own grief, acknowledge it, and work through your losses, because I guarantee we're all struggling from losses, big and small. And secondly, be mindful of what grief model, or models plural, you introduce into that counseling setting, because it matters.
Right, thank you. All right, so do you want to go through your GRACE model now that we know a little bit more about grief and where it originated from?
So the grief model that I created is it's a new understanding of grief, right? So it's a new understanding of what grief is as a complex and multifaceted process for healing from loss, and how we can connect, or actually reconnect, to the ways that we are innately hardwired as humans to deal with loss. So my model is rooted in evidence-based materials. So it's primarily rooted, it comes right out of CBT. And then I had to add narrative therapy to kind of a narrative therapy, and within a framework of meaning making, inclusive of spirituality. I added these extra components because I had to, because for those of us already using CBT, which is often understood as kind of the gold standard, right? We know that CBT falls short in the treatment of grief. We know that CBT is lacking in the treatment of grief. And so we end up having to pull these other models. So the models that I added have this kind of wonderful complementary and very congruent fit. And they are also as a standalone effective in the treatment of grief. So combined, this what's called the grace grief model really offers this kind of elegantly simple yet very powerful way to address grief. So I'll go through kind of at a high level, and I've just stop me if you have any questions as I go through it. So just since we're in an environment where everyone's used to the actual theories and the modalities, I'm going to talk just briefly about that. So why cognitive behavioral therapy and narrative therapy and meaning making? So first, the cognitive behavioral techniques in general target the loss related processes and focus on the symptoms of painful intrusive memories and behavioral avoidance. So that's why CBT. It's evidence-based. Most of us use it on a daily basis. The narrative therapy techniques, which I added, explore that multidimensional identities and removes the identity as quote unquote the problem. So like in grief, and one of the deficits of cognitive behavioral therapy is that it wants to kind of, as we know, kind of pathologize. It looks for a disorder. It looks for a diagnosis. And so, but when someone's grieving, it's not necessarily a disorder or a diagnosis. It's that they've lost their child or their husband or their job. And so the nice thing about narrative therapy, it does just the opposite. It doesn't want to identify their identity as quote unquote the problem. It wants to support the telling and retelling of a story in ways that promote healing. So very powerful there. And third, the meaning making elements kind of support the overall restoration by helping reestablish connection with valued life goals, including, spirituality. So again, kind of going back to the worldview, and then that helps us, with the storytelling and the meaning making with our views of the loss event. So all of these kind of really mold and dovetail nicely into this kind of unified model. So the grief model tackles the roadblocks quite simply in other existing grief models that I found, and it fills in the gaps. It also is important because it really works to help dispel stigma. So the grace grief model can be understood simply as this: biologically imperative, emotionally healing, and spiritually nurturing. In the grace grief model, grief quite simply is redefined. Redefined as three things. Number one, good. Good because grief, when we grieve in healthy ways, that grief work, that is how we heal from loss. Grieving is very good indeed. Number two, grief is going to ebb and flow. It is cyclical, in other words. It's not a stage, check off the list process. Rather, it is this kind of ongoing process that kind of moves in and out of our life, kind of like a wave that comes and it goes, and it's cyclical. And why wouldn't we want it to continue to come back? Even though in our culture, we kind of bristle at the idea of grief and we want to avoid it oftentimes. But grief is the harbinger of healing. That is exactly the process that's going to help us deal with all of our losses. So why wouldn't we want to invite it to our dinner table and have it sit with us and heal us? So grief is indeed going to ebb and flow, and grief is good. And third, I say grief is a gift for those reasons. Grieving, when we grieve in healthy ways, is how we heal from losses. And think about this. Our human condition is one that losses, big and small, are going to be like a thread that weave themselves in and out of the fabric of our lives, all of our lives. And the longer we live, the more losses we accumulate. And so loss will always be a companion that we walk with on this journey, on this earth. And so we need this mechanism for dealing with loss. But the beautiful thing is that our bodies are actually innately hardwired to deal with that. We have that mechanism, and we call it grief work. The problem is, and you see this especially when you look at other cultures, the problem in our kind of more westernized culture is that we have unlearned our natural process of grieving. And so a lot of this model just helps us relearn what comes very natural to us. And so this is kind of the power behind the grace grief model. I'm not introducing anything earth shattering. I'm I'm reuniting with these natural processes that have always been innately part of who we are. Think of it this way. We were all wonderfully made, right? We were created out of flesh and bones, but we're also created out of stardust, meaning that we literally have atoms inside of us that are billions of years old. And we have trillions of those atoms inside of us. And those atoms came from literally the stars in the universe. And so we are created with stardust. Think about that for a second. We have these atoms that are billions of years old within inside of us. That's a lot of innate wisdom in that body. And our body is already hardwired to heal. We heal, you know, if we were to fall down and if I was to scuff my elbow, a scab would form, right? But if I was to fall and break my elbow, the bones would try to knit themselves back together. Now, as clinicians, we all know that physical healing isn't always possible, but there's always a different type of healing, you know, like spiritual or emotional, but that's another conversation. But the sum of it is that our bodies literally are hardwired to heal. And so if I've said that there's this lost thread that's going to weave itself throughout our life, how then are we hardwired to heal from the loss after loss that's going to come in and out of our existence, out of our narrative? The answer is grief work. And isn't it ironic then that grief work is the very thing we run from in our culture? And so grief definitely has a stigma problem that I'm trying to work on. And many of us, many of y'all included, are trying to work on that. So the grace grief model really takes a different approach to grief and sees it as good, as cyclical, this thing that's going to ebb and flow, and is this amazing gift for healing, for growth, and for throughout our lives. So those are some of the big precepts of that. Kortney, I can definitely go into a lot more detail, but I'll turn it over to you for a second.
No, I was just going to say, in your book, right, you said that grief finds a place in our lives. And I think that's a really powerful statement. And I think when people can accept that, right, because like you said, with CBT, we can't always change our situation, but we can always change how we, you know, think and feel about it. And I think when you give that person that power to kind of be able to choose, you know, how they want to react, I think it's really part of that whole grieving process. And it sounds almost like resilience, right? And I like that you make the point of, yeah, when our bodies, you know, when something happens to us, it just knows how to heal itself. And I think if more people had that view of when something happens to us emotionally, we are hardwired to know how to deal with it. I think they'll feel more comfortable, you know, doing so. My question is, so when we talk about how grieving is good, and I completely agree with you, a lot of clients have a hard time with that statement. And you talked about the awareness, action, and change. Do you feel like it's appropriate to discuss how grieving is good in the first session of the grief work, or do you feel like the client has to be ready to hear that?
I think the place to start, that's a great question, Kortney. I think the place to start is an understanding of what grief is. And that's where we get off, because a lot of people, if you ask them what grief is, like if I'm doing a workshop, that's one of the questions I'll start with, is just I'll ask, you know, what is grief? And 9 times out of 10, I'll get these responses back. Grief is pain, it's sorrow, it's death, it's loss. And it's all of these kind of really heavy, difficult emotions. So basically, they're describing grief as a feeling. Grief is a feeling, first and foremost, and we can talk about, you know, how feelings are processed in the body and all of that. But the grief is not just a feeling. Grief is so much more than a feeling. And I think that's where in our culture we've lost the importance of what we've lost the capacity to heal within this notion of grief, because we don't understand the notion of grief. How we define grief, I think, is askew. In other words, grief is so much more than emotion. Grief is an emotion, and it's important to talk about that and to process that and to work through that. But understanding that grief is so much more. We now know, because of neuroscience and all the advances made in neurobiology and our understanding of the brain, we now know that grief is not just a psychological condition. It is very much a physiological condition, and helping the clients understand that can go a long way. For example, when we grieve, there's a part of the brain that literally grieves. And so when we connect to someone, for example, when we connect to somebody, this has to do with like brain mapping and remapping, but grief is physiological and psychological in the body. What does that mean? There's parts of our brain, when we connect to someone, like through a bond, like love, when we love someone, the brain maps for that person. It literally hardwires for that person in the brain. It's not just an emotion. It is an emotion, or a set of emotions, plural, but it literally also biologically maps for that person. So what does that mean in the case of loss? So what if I get a divorce or that person dies? The emotions are definitely going to be prevalent, but also the mapping, that literal biological wiring for that person didn't dissolve. It's still there. And that pain has been described as, like in the case of a spouse that lost their loved one due to, death. It's been described as much like an amputee feels the phantom pains. That ache is very real. It's that yearning, that searching for that person. It's not just emotional. The brain is literally looking for that person, searching for that person as if they're still there. And so what needs to happen and this is fMRI images show this. We now know that this is biologically really going on inside of us. And so what needs to happen after a loss is we have to help the clients. We have to help our patients understand that the brain is mapped in a certain way, and then a remapping has to occur. And this takes time, and it's a process. And so I think that's a good place to start. Did that help, Kortney?
Yes, thank you.
Yeah.
And with the kind of remapping, I've had some clients, and I'm sure other people have too, that they feel guilty about not having those grief triggers anymore and not being as sad, as they once were, or feeling happy. Then it's like, oh, I can't be happy because I'm still sad over the loss of the death. How do we work through that with our clients?
That's a really important point. And again, I think this goes back to our stigma about grief and thinking that, oh, grief is just the feelings of pain and sadness and hurt and loss. Grief, if we were to take out the feeling wheel, it also includes the happiness and the joy. And let me give you an example. If I'm I've done many funerals, and if I'm doing a funeral, I'm sitting up or standing up in the pulpit, and the family's usually seated, down here or standing down here on my left. And it usually happens during the hymns. So when someone in a funeral, they'll stand and sing the hymn that maybe the loved one chose or that the family chose. And then the strange thing happens. The family is crying often, but then they will start to smile. So you see this kind of juxtaposition, both the pain and the joy, because I would argue that you're not going to see necessarily happiness at that point, but what is always present is joy, right? Joy can exist in a moment of pain like that, in a moment of sorrow. You can see joy as they remember this beautiful song or they think of some sweet memory. You can have both exist at the same time. And that speaks to the complexity of emotions, but it also speaks to how we failed as and I say as a culture, but I think we fail in a lot of senses, understanding that grief is both. It's not just the pain, it's also the joy, it's also the happy memories. It's both. And helping them understand that even guilt, feeling guilty that their loved one is not with them and passed, and feeling guilty that they are kind of moving forward without them. These are emotions we have to work through, helping them understand, though, guilt has this component of kind of earned guilt and unearned guilt. And usually when we're talking about grief, it's a lot of unearned guilt. but processing the feelings is important. But all that to say, it starts with an awareness of what grief really is. Grief is this beautiful way, this process that we are innately hardwired with to heal and to move through loss, not just with sorrow, but with joy, with happy moments, with some beautiful moments as well.
I think that's a great distinction, because death is different than grieving. And I think you're right. It's important to acknowledge the positive feelings that you have with grief and not just the negative ones.
I think in grief, and and in counseling, when we talk about positive and negative feelings, I understand what you're saying, but I also help my clients understand that when we talk about positive and negative feelings, we're not talking about is saying that, like in the context of grief, oh, if you feel these things on the other side of the feeling wheel that I'm sure we all use, the feeling wheel, such as, happiness and joy and contentment and these kind of things, those are also grief. And those are not necessarily negative in the context of good and bad. These are, I help them understand that really we're just talking about healthy grief feelings, which run the gamut of the entire feeling wheel. And when I say the feeling wheel, I think everybody here on this call knows what I'm talking about, right? It's just a word bank that has feelings kind of in a pie chart that if you haven't seen it, definitely Google it, feeling wheel, and you'll see the images. But grief runs throughout all of our feelings, and helping them understand that it's not a matter of good or bad, but just more healthy. What's healthy. And then also with feelings, it's not like we pick our feelings. Feelings come to us. We don't get to choose which feelings come. And so part of the big thing we have to start with is not judging whatever feeling or feelings come to us, but allowing the feeling instead of blocking it, which we're experts at because we don't want to deal with that feeling, just to simply let it wash by, to feel the feeling, which helps with awareness, to name the feeling, right? Which helps with validation, and then to process that feeling, to learn and to grow from the feeling. So a lot of emotion and feeling work when it comes to grief, for sure. But that's also most of the work that we do as counselors and as mental health practitioners, is dealing with a lot of emotions, right?
Say, Kortney, I have a quick question for Dr. Towns. What about the separation of one from either an unhealthy relationship or situation that causes grief versus a loved one, or that more common understanding of loss? What if you lose something that wasn't good for you? Do you experience grief in those situations?
Yes, you absolutely can lose grief, and it can experience grief in situations whereby that which was lost wasn't even good for us. You can have this kind of period of mourning and grief, from the addicts that we work with who are addicted to certain substances. When they go into rehab, there's a normal, healthy amount of kind of grieving that needs to go along with that. Now, as part of that, a lot of times we realize that what we were addicted to, whether it was a substance or a relationship that was toxic for us, oftentimes there's a lot of more that we have to kind of dig down, because there's usually we enter into those unhealthy relationships because of something else there, maybe, or we enter into the substance use because we're self-medicating for something else there. So a lot of times the grief is always there, but it's something that you're going to have to work through in addition to whatever pathology or whatever mental health struggle is kind of enjoined up into that. But absolutely, yeah. Like I said, almost everyone we see come sit in our office is going to be grieving something, no doubt.
Say, Kortney, what do you think about questions? I don't have any questions in the chat. Maybe there might be questions from the community. If you feel you'd like to ask a question or join the discussion, now's a good time. You would just need to unmute, introduce yourself, and join.
I have one more question I can ask if we're waiting for.
Yeah.
people to ask theirs. Dr. Towns, you talked about connection and how obviously that helps kind of the grieving process. What happens when, and I know it can be common, everybody, grieves differently. And so if you are parents and you're grieving the loss of a child, I know sometimes they do grieve differently and it can cause a lot of tension and conflict. What's the best practice in helping a family? I'm sure you did this, with, your ministry too, helping families go through it when they're kind of at different parts in the model.
It's a great question in the sense that as individuals, we don't grieve in a uniform fashion. And when we grieve collectively, like in a family who's grieving the loss of a child, whether the loss is because of a death or maybe an estrangement, right? Some children at any age, much less adult age, we deal with this a lot where the children don't have anything else to do with the parents, at least for that time. And so there's this kind of estrangement going on. The family members that come to us for help, they're not going to be grieving at the same level. If you look at that grief map, they're going to be at different points in that map. And so they're going to need different support depending on where they are in that map. But the place to start is just an understanding of talking about what grief is to them, and then helping them understand what the loss is to them, because the loss in this case is this kind of relational or connectional, right? And so, and then, depending on the situation, it can be helpful even to help them understand that this is not just an emotional, but this is also this kind of biological thing going on inside them, because they're like, well, I'm very rational. Why can't I just accept this? Why can't I accept this? Well, first of all, emotions aren't rational, number one. But secondly, because you have this physiological part of your brain that is literally hardwired for that person to walk in through the door. And so you keep looking for them. You keep yearning and searching for them. And so sometimes it really can be helpful to add the neuroscience behind this. And so I think one of the things as practitioners in healthcare, and for those of us counselors that maybe we didn't get that neurobiology training, that neuroscience training when we were going through, but it needs to be included. So we need to be neuro-informed, neuro-leaning in how we treat our clients, because a lot of what we think we know about certain conditions like grieving, they've been absolutely upended with emerging biology and emerging neuroscience information and research. And so I think adding a little bit of that in ways that feel comfortable for the practitioner. I'm not saying, talk about things that are outside of your wheelhouse, but read some articles, share those articles with your clients about the biology of what's going on with them when they're grieving. And because it changes not just the brain, but the physiology of it, right? And so helping them understand why they feel the way that they feel is, I think, a great place to start. And then, kind of working through the grief map and just helping them get into alignment with their meaning, the worldview and their loss view, and helping them understand where there might be a misalignment, and working through the kind of restoring of the narrative that they keep telling themselves and others about the loss, kind of expanding that. Restoring the loss does not mean changing the reality of what happened. Restoring is this amazing opportunity to open up to the fullness of what really happened. Because in the case of a loss, and I would say the more traumatic the loss is, the more likely a story that we lay down could be problem saturated, in the sense that when we go through a loss, we tell ourselves a story of what happened. This is what happened. So what's the problem with that? The problem is that when we go through that loss, often the part of the brain writing the story is the amygdala, which is the emotion center and the alarm center. And so what does that mean? That means the story that we tell ourselves is not written in facts, it's written in emotions. And so that's what those emotions, that's what gets laid down with the memory, and that's what gets put into our brain. Restoring with our clients means we allow them to tell their story, and then we ask questions. What else happened during that time? Where were their helpers in that time? Have them expand on the reality of what really happened. So the restoring allows for a new, healthier story to be told, which means that's usually what will help that person bring that loss event, that loss story into alignment is through the process of restoring.
Thank you. Do we have any community questions? Anything in the chat? No? All right. Dr. Hans, that was very informative. Thank you for being here. Do you have any takeaways, anything that clinicians can do, starting today or tomorrow to help clients who are grieving?
Honestly, I think the place to start for us as clinicians is let's turn this inward first, right? And as clinicians, we're really good about helping others. And I would just encourage the clinicians, the same thing I have to remind myself all the time. And that is that fill your own coffee cup up first, right? So this is a coffee chat. So fill your own coffee cup up first. Make sure that you've done your work. Make sure that you're working on your grief and your kind of those pinch points that are kind of wounding and rewounding you, because they're there for all of us. And again, the longer we live, the longer we are going to have to deal with grief. And so that self-care for clinicians, especially around the areas of loss and grief, I think is very powerful. Understanding that as professionals, we are going to deal with grief, our grief, others' grief, and we're going to kind of transfer some of that. And we're going to project some of that sometimes it's going to happen. So the place to start is kind of dealing with it ourselves. But it's very easy to tell someone else how to work through their grief. At least it is for me. But it's tempting for us to remain kind of stuck in our own grief. But staying stuck in these, what I call these imagined safe harbors, is this really dangerous place where we get lulled into feeling comfortable and normal with a very unhealthy grief narrative that we're walking around with, which means we're walking around wounded, and sometimes we don't even realize it. So to heal, we've really got to move into those kind of difficult waters of grief work, the grief work, the grieving process itself. That is the healing. Grieving is the healing, the grace offered to us following a loss. And again, this is not something that you have to go out and learn. It's really something that we just have to get our mind out and ourselves out of the way of, because our bodies are innately hardwired to go through these processes. Our bodies want to tell a healing story. Our bodies want to heal. And so sometimes we just have to get ourselves out of the way. So that's the advice I would give to my fellow worker out there.